Hi viewers, in this video we are going to learn about coronavirus and COVID-19, which is one of the fastest spreading diseases all around the world. What is a coronavirus? A coronavirus is a group of viruses that can cause illness in animals or humans. Common signs of infection include respiratory symptoms, fever, cough, shortness of breath, and breathing difficulties. In more severe cases, infection can cause pneumonia, severe acute respiratory syndrome, or kidney failure, and even death. A coronavirus gets its name from how it looks. Under a microscope, this virus exhibits spikes that resemble a crown. There are many coronaviruses that only infect animals. Some evolve in their animal hosts to infect humans. In recent years, they have become a growing player in infectious disease outbreaks worldwide. The type that infects humans was first identified in 1960s. Since then, 7 human infecting types of coronavirus have been identified, including the latest virus. 4 of those types cause common colds. 2 others, by contrast, rank among the deadliest of human infections. One is severe acute respiratory syndrome, or SARS. The second one is Middle East Respiratory Syndrome, or MERS. SARS coronavirus, or SARS-CoV, is identified in 2003. It is thought to be an animal virus from an uncertain animal reservoir, perhaps bats, that spread to other animals and first infected humans in southern China in 2002. SARS epidemic affected 26 countries and then resulted in more than 8,000 cases in 2003. Middle East Respiratory Syndrome is a viral respiratory disease caused by a coronavirus called MERS coronavirus that was first identified in Saudi Arabia in 2012. Till date, MERS-CoV infection cases reported globally to World Health Organization is 2,506 with 862 associated deaths. So approximately 35% of the reported patients with MERS-CoV infection have died. The new virus, which is currently spreading all around the world, is called Severe Acute Respiratory Syndrome Coronavirus 2, or SARS-CoV-2. The disease it causes is called as COVID-19. The number stands for 2019, the year it emerged. This disease was unknown before the outbreak began in Wuhan, China in December 2019. Now let's see, where did this SARS-CoV-2 virus came from? The virus appears to have originated in Wuhan, a Chinese city about 650 miles south of Beijing that has a population of more than 11 million people. The Huanan seafood wholesale market, which sells fish as well as panoply of meat from other animals, includes bats, snakes, pangolins, was implicated in the spread of this virus. The very first patient identified had not been exposed to the market, suggesting that the virus may have originated elsewhere and been transported to the market. Even though the exact source of the virus is not known till date, but initially it was believed that the virus is similar to those seen in the bats and likely originated from them. As time went on, more and more research was conducted, and Chinese researchers were able to determine that COVID-19 shares 99% of the same genetic information as a similar virus that infects pangolins. But how did this COVID-19 spread among humans? Let's see. People can catch COVID-19 from others who have that virus. The disease can spread from person to person through small droplets from the nose or mouth, which are spread when the person with COVID-19 coughs or exhales. These droplets land on objects and surfaces around the person. Other people can catch this COVID-19 by touching these objects or surfaces, then touching their eyes, nose or mouth. People can also catch COVID-19 if they breathe in the droplets from the person with COVID-19 who coughs or exhales droplets. This is why it is important to stay more than 1 meter or 3 feet away from a person who is sick. Studies to date suggest that the virus that causes COVID-19 is mainly transmitted through contact with the respiratory droplets rather than through the air. Now let's see who is at risk because of this virus. There is no known immunity to COVID-19, which means that everyone is at risk of catching this and spreading the infection. That doesn't mean that this is the perfect time to panic. COVID-19 can be dangerous, but like most infections, certain portions of the population are more at risk than others. Young children, healthcare professionals, the elderly, and the people with a compromised immune system are the ones who are more at risk. When a healthy adult contacts a virus, there is a possibility that they will not show any symptoms at all and won't get sick. This is one of the reasons the virus has managed to escape the confines of Wuhan, China, to infect the world. Now let's see what are the symptoms of COVID-19. The most common symptoms of COVID-19 are fever, tiredness, and dry cough. Some patients may have aches and pains, nasal congestion, running nose, sore throat, or diarrhea. These symptoms are usually mild and begin gradually. Some people become infected but don't develop any symptoms and don't feel unwell. People become ill between 2 to 14 days after infection according to the most estimates. Most people, about 80%, recover from the disease without needing special treatment. Around 1 out of every 6 people who gets COVID-19 becomes seriously ill and develops difficulty in breathing. Older people and those with underlying medical problems like high blood pressure, heart problems, or diabetes are more likely to develop this serious illness. People with fever, cough, and difficulty breathing should seek medical attention. Now let's see how to protect yourself and prevent the spread of the disease. Regularly and thoroughly clean your hands with the alcohol-based hand rub or wash them with soap and water. Maintain at least 1 meter or 3 feet distance between yourself and anyone who is coughing or sneezing. Avoid touching eyes, nose, and mouth. Make sure you and the people around you follow good respiratory hygiene. This means covering your mouth and nose with your bent elbow or tissue when you cough or sneeze. Then dispose the used tissue immediately. Stay home if you feel unwell. If you have a fever, cough, and difficulty breathing, seek medical attention immediately. Keep up to date on the latest COVID-19 hotspots, that are the cities or local areas where COVID-19 is spreading widely. If possible, avoid traveling to these places, especially if you are an older person or have diabetes, heart or lung diseases. Finally, stay informed on the latest developments about COVID-19 and follow all the safety measures. Now, what to do if you think you are infected with COVID-19? Let's see. The very first thing you need to do is don't panic. Panicking doesn't help you or your loved ones. So, you need to take care of yourself to ensure you don't spread the infection and make sure you get a proper care. If you develop a fever along with the symptoms of respiratory illness, you should call your healthcare provider and ask for his advice. If you fear you truly did come in contact with someone infected with COVID-19 and are concerned that you may have it as well, then you need to get tested. When you leave the house to get checked, be responsible and keep your mouth and nose covered. This will keep you from passing the virus to other people. If you have a surgical mask, you can use. If not, you can use a scarf or similar article of clothing. Your local hospital may not yet be equipped with the testing kits of COVID-19, so call your local public health department for information on the best places to go. Now let's see some common questions and answers regarding the COVID-19. Is there a vaccine, drug or a treatment for COVID-19? No, not yet. To date, there is no vaccine or a specific antiviral medicine to prevent or treat COVID-19. However, those affected should receive care to relieve symptoms. People with serious illness should be hospitalized. Possible vaccine and some specific drug treatments are under investigation. They are being tested through clinical trials. Should I wear a mask to protect myself? Only wear a mask if you are ill with COVID-19 symptoms or looking after someone who may have COVID-19. Disposable face masks can only be used once. If you are not ill or looking after someone who is ill, then you are wasting a mask. Can I catch COVID-19 from my pet? No. There is no evidence that companion animals or pets such as cats and dogs have been infected or could spread the virus that causes COVID-19. So finally, is there anything I should not do? The following measures are not effective against COVID-19 and can be harmful. 1 is smoking, 2. Taking traditional herbal remedies. 3. Wearing multiple masks. 4. Taking self-medication such as antibiotics. In any case, if you have fever, cough and difficulty breathing, seek medical care early to reduce the risk of developing a more severe infection, and be sure to share your recent travel history with your healthcare provider.
Currently, within less than 3 months of time after finding the first case of COVID-19, more than 1 lakh cases were reported in more than 100 countries around the world, out of which more than 70% of the cases were reported from China alone. The current fatality rate stands at 3.5%, which is slightly higher than the initial estimates of 2 to 3%. But the noticeable fact is that the number of cases and deaths were drastically decreasing in China but are rapidly increasing in other countries day by day. So by taking proper precautionary measures and creating awareness among public, the spreading of this virus can be controlled without causing further damage. Thank you for watching this video and see you again with another interesting topic. Till then, bye bye.